At this year's 2025 IMS meeting, we presented analysis of a MASH-adjusted indirect comparison of Linvoseltamab compared with Idecabtagene vicleucel and Cilta-cel autoleucel, which are two approved BCMA CAR-T products. So just as a brief background, Linvoseltamab is a BCMA bispecific T-cell antibody that was recently approved for the treatment of triple-class exposed relapsed refractory multiple myeloma in patients with at least 3 prior lines of therapy in the European Union, at least 4 prior lines of therapy in the United States. And while we do have several BCMA-targeted options for the treatment of relapsed refractory multiple myeloma, there exists no head-to-head comparison between these agents that currently exist. So in the absence of these head-to-head trials comparing these approaches, a MASH-adjusted indirect comparison is a standard methodology to compare outcomes between clinical trials while adjusting for baseline patient characteristics. So in this analysis, patient-level data from the pivotal LINKER-MM1 study with Linvoseltamab, as well as aggregated data from the KarMMa-1 study with ide-cel, and aggregate data from the CAR-T1 study for Cilta-cel were used for this particular analysis. And in summary, what the outcome showed is that in this MAIC analysis, when comparing Linvoseltamab with ide-cel, the complete response rate were better, the duration response and the progression-free survival was significantly higher with Linvoseltamab compared to ide-cel, and the overall survival was numerically higher with Linvoseltamab compared to ide-cel. When looking at the MAIC comparing Linvoseltamab with Cilta-cel, the duration response was significantly higher with Linvoseltamab. The progression-free survival was similar between Linvoseltamab and Cilta-cel, while the overall survival was numerically lower with Linvoseltamab compared to Cilta-cel. So taken together, what this really analysis I think shows is that Linvoseltamab may provide a clinically meaningful alternative and an off-the-shelf approach compared to some of the CAR-T approaches that we currently have for the treatment of relapsed refractory multiple myeloma.